Hi, I'm Prerna Reddy. I'm the director of the Talk Learn Rehabilitation Center, Hyderabad. Today I'm going to talk about a very important topic, echolalia. A lot of parents that come to us, my child in speech say we have echolalia, and echolalia is treated in a very negative term. They always say this echolalia should stop, only then my child will start communicating more relevantly to me. Okay, so now echolalia, why does it happen? How does echolalia look like, and what can it actually mean? Echolalia can look like, echolalia is of two types basically. One is immediate echolalia. So if I say what is this, the child will repeat what is this immediately. So whatever you are telling, the child just repeats it as is. That's immediate echolalia. The second type is delayed echolalia. So suppose you say something like, oh, it fell down. Now the child might use it later, maybe relevant to the situation or may not. If something falls down, the child might say, oh, it fell down, or may not, sometimes may not be relevant, may just use it if the child sees meaning in it, and we may not see it. Why does echolalia happen? Okay, so far research for many years said that echolalia is very pathological. Even me as a speech therapist, until some years earlier, I thought even echolalia is pathological. I need to stop, and it is something that needs to be broken down. Now we understand, because of Gestalt language processing and the evidence that has come up, that echolalia is meaningful and the child is trying to communicate something at that point of time. Because the child does not have flexible language or does not have enough language, the communication looks like echolalia or just the child repeating. But when you look at the way that the child is repeating, what the child is reporting, what information, you get that what he communicated was meaningful, but it was not understood by you. Now, what does echolalia mean for us? It means it's the first stage of Gestalt language processing, that the child is processing language the Gestalt way, and that's why the child has echolalia, is what we understand now. And as parents, what should you do? If your child has echolalia, what you should do? First thing, stop thinking it is pathological and it is something that you need to stop. Second thing, recognize that your child might be a Gestalt language processor and ask your speech therapist, what is Gestalt language processing and how should I support my child for Gestalt language processing? Thank you.